and I'm here to present today the effects of sun exposure, particularly skin cancer and melanoma. Thank you for letting me come to talk to you today. So mostly sun exposure, you think about it during the summertime, but this time of year and in the winter, I mean, you think about it, the sun's out all the time, so we have to be careful about our exposed skin with the sun. So overview, we're going to talk about the effects of sun exposure on the skin. There are different types of cancer. There's basal cell carcinoma, there's squamous cell carcinoma, and there's also malignant melanoma. So we're going to talk about the characteristics, what to look for, and when to seek medical help. I'm also going to include treatment and methods of prevention. So the effects of sun exposure, the biggest is, if you think about it, the skin is the largest organ of the body, so it's most affected by sun exposure. Skin cancer is caused by the ultraviolet rays of the sun. It's the most preventable cancer, and it's the most common type of cancer in the U.S. Mostly people with fair skin, they are at most risk for skin cancer. There's an increased incidence of skin cancer due to recreational and occupational sun exposure, such as farmers and construction workers who are out in the sun more. There are precancerous skin growths, and these are called actinic keratoses. They appear as rough, dry, scaly lesions on the skin, and they're often easy to pick off, but they'll just return. They won't go away. If not treated, they can actually turn into squamous cell carcinoma, and all of these growths that we're going to talk about, except for the malignant melanoma, usually appear on the face, the lips, the ears, the scalp, the neck, the hands, and the arms. So this is what an actinic keratosis looks like. You can see it's kind of a little crusty, and it looks like you can pick it off, and it just keeps coming back. The basal cell carcinoma, now this one is the most common type of skin cancer. It's very slow growing. It's commonly seen in the elderly. We've got some pictures coming up of this one, and you'll see it appears shiny, dome-shaped with a pinkish sore that returns. It rarely spreads to other parts of the body, and it usually has a good prognosis. Most common, again, on the skin of the face, hands, neck, nose, scalp, things like that. So these are the basal cells. They look a little like ulcerated, little lesions that are pearly with a dome shape, and they can look different. They all don't have to look the same, and these are all basal cell carcinomas. So squamous cell carcinoma, this is the second most common type of skin cancer. This one's more aggressive and can grow more quickly. It appears on the skin in many shapes and sizes. This one usually looks like a crusted area, a little rough red patch. It can also look like a sore or ulcerated area that bleeds and doesn't heal. And it can be seen in places of the body that are not exposed to sun on this one. And if this one's not treated, it can spread to other areas of the body. So squamous cell, that's what it looks like. It's kind of a mixed bag, different things. And this one's a little more deadly. The worst though, malignant melanoma, it's the most deadly form of skin cancer. Utah actually has the highest rate of melanoma in the country. One of the reasons is because of the elevation we're at, and people are out in the sun winter and summer. It's related to the amount of sun exposure and sunburns that a person has accumulated from childhood to adulthood. It's actually caused by frequent use of tanning beds, and this can increase a person's risk by at least twofold. Early detection and effective treatment could mean the difference between life and death with the malignant melanoma. So it may develop in an existing mole or on normal skin. There's guidelines to look for, and I'm going to be giving out brochures too that'll give highlights, pictures, things like that, and to refer to. So it's ABCDE guidelines. A is for the asymmetry of the mole or lesion. B is a border has irregularity. C is there's a change in the color. D, the diameter is greater than the size of a pencil or eraser, greater than 6 millimeters. It's evolving, which means the lesion is changing in color, size, shape, and all of the above. And if a person has 2 or more of these characteristics, there's an increased higher risk of it being a melanoma. Later signs that you would see with this would be ulceration, bleeding, pain, or itching, and this has a poor prognosis when it gets to this point. Heredity can actually play an increased risk for melanoma too by 3 to 8 times. These are what the malignant melanomas look like. So there's no really one thing fits all. They can all look different and all be deadly. So treatment for all cancers, a biopsy is usually the initial step to determine the diagnosis and the treatment. Treatment plan is developed depending on the pathology result. Then complete surgical excision is the most common, and the pathology is always done to make sure the cancer is entirely removed. So if the cancer is spread from the primary lesion, then chemotherapy or immunotherapy may be recommended to cure or prevent further spread. Prevention, you want to make sure and avoid the sun during the peak hours of exposure. So 10 a.m. to 2 p.m. and even on shady days when you think it's safe. Water, sand, and snow because they intensify the sun's rays. And again, tanning beds. So you'll want to apply some water-resistant sunscreen, SPF 30 or higher. And really, you get much higher than 30 and it doesn't do a lot of good, but especially on your, again, face, neck, ears, hands, and arms. And then wear sunglasses, long sleeve shirts, and long pants, wide brim hats to protect your ears and neck. And seek shade when you can, stay out of the sun. Summary, so periodic self-exam of the skin and a routine appointment with a dermatologist is important for early detection. People who freckle and burn instead of tan have an increased risk of melanoma, and persons with darker skin tone also get melanoma, but more commonly on the palms of the hands and soles of the feet. And the incidence of skin cancer increases with the accumulation of sun exposure. So early detection and early diagnosis are the key to successful treatment and the best prognosis. So again, I'm going to go